Hello, listeners. This is Johnny. Welcome to my podcast, Chase Cover. For today's episode, we are going to talk about lobotomy, the Lobotomy. So, lobotomy is popular in the mid 20th century. It was introduced by a Portuguese neurologist, Agas Moniz. So, it is a surgical procedure that involves the removal or the disconnection of a certain brain structure, like typically the prefrontal cortex. So, they believe that it is like a treatment for some people who have mental health issues like severe psychiatric disorder, schizophrenia, and severe depression. And have you seen the procedure? It's very traumatizing. So what happened there is that they have the lobotomy pick. So the lobotomy pick is a cylinder and pointy instrument designed for the specific purpose. So it penetrates the thin bone of our eye socket, like the orbital bone, accessing the front lobes of our brain. Imagine being anesthetized and yet that slender thing will be placed in your eye socket. It's so scary. So in that procedure, they call it the eyelid retraction. So they use a device to hold the patient's eyelid to open, and then after that, the insertion of the lobotomy pick. So the lobotomy pick was inserted above the eyeball, and then it angled upward toward the frontal lobes of the brain. So once the pick was inserted, it was moved from side to side to sever the connections between the frontal lobes and the rest of our brain. So this procedure was intended to disconnect or to deactivate the frontal lobes, which were believed to be associated with certain mental health disorders. So after this procedure, the lobotomy pick was it was removed, and then the incisions were typically left to heal on their own. Imagine being stabbed of the pick and it was left open. So there were no stitches or closure of the incisions. So it is believed that lobotomies were often performed without the use of sophisticated imaging or precise targeting. And because of that, it causes so much damage to the brain. So the patients who underwent lobotomies experienced significant personality change and then cognitive impairment, issues. So if I were born in the mid 20th century, I would never try that kind of surgery. I guess I'll work on my own depression alone by myself rather than to stab my eye socket with a slender pick. It's so scary. So it is a lesson for us that before we jump into doing something, make sure to understand the risk and the potential consequences of any medical procedure and the medical interventions, especially when it comes to brain. It should be based on scientific evidence and rigorous research, So this story really highlights the dangers of doing something without understanding the full outcome. So us should be aware of our actions and the outcome that we perform before we do such things like that. It's so dangerous. It's so interesting topic, and you guys, I hope you learned something from that. It's so interesting. Bye bye.